everyone. My name is Reva Spillane, and I'm a Master's of Public Health student at St. Ambrose University. Today, I'm going to present a multi-level approach to addressing chronic disease rates among aging rural residents using the social ecological model. To set the scene, the aim of the interventions that I have found target rural citizens living in Wisconsin that lack access to high-quality health care. As a result, conditions like diabetes, hypertension, and heart disease go undiagnosed or inadequately managed, leading to higher rates of complications and premature mortality. The statistics alone highlight the stark divide between rural and urban residents. When it comes to chronic disease, chronic respiratory disease is 38% more common in rural areas, heart disease is 17% higher, strokes occur 15% more often, and there is a 10% increase in cancer diagnosis. As for life expectancy, rural men live 3 years less than urban men. Comparatively, rural women live about 2.7 years less than urban women. Also, the patient to primary care physician ratio in rural areas is 39.8 physicians per 100,000 people, as compared to the 53.3 physicians per 100,000 people in urban areas. On top of this, only 8% of all physicians and surgeons choose to practice in rural settings, decreasing the availability in specialty care as well as advanced diagnostic technology in these areas. With about 20% of Americans living in rural areas and barely 1/10 of medical providers practicing there, the federal government projects a shortage of over 20,000 primary care physicians in rural areas by the year 2025. The guidance of this presentation comes from the social ecological model used in public health. It is a framework that identifies how various factors at different levels, including the individual, relationship or interpersonal, community and organizational, and societal levels influence health behaviors and outcomes. The health of people is greatly affected by their environment and personal characteristics. This model is a great tool to use when looking to address factors that influence health outcomes. In this case, the levels are used to explore interventions that can be implemented by individuals in each category to create change for rural Americans suffering from health inequities. From an individual standpoint of the social ecological model, the National Council of Aging created the Enhanced Wellness Program, an evidence-based remote intervention that connects individuals with a personal health and wellness coach to improve physical, emotional, and social well-being. Individuals that utilize this program engage in problem-solving strategies, goal setting, personal responsibility, and activities that work toward health-related behavioral changes. This program works well as a hub to refer to other health promotion interventions and community resources. Most chronic diseases are caused by a short list of risk factors, including tobacco usage, poor nutrition, physical inactivity, and excessive alcohol use. The individual can avoid these risk factors by quitting the usage of cigarettes, eating a balanced and nutritious meal, getting regular exercise, and limiting alcohol consumption. Topics available on this platform include physical activity recommendations, chronic disease management, diet and nutrition guidance, smoking habits and quitting, and social connections. With the connection to these resources, individuals have the ability to educate themselves on health habits that are affecting their overall health and well-being in both the short and long term. At the interpersonal level of the model, the National Council of Aging created yet another intervention, only this time encouraging social interaction. The interpersonal intervention is effective in increasing the commitment to adopt health-promoting behavior because of a social connection to others. So often, people are influenced by the behaviors and attitudes around them, and the use of peer interventions can leverage this dynamic to promote preventative health measures. The Enhanced Fitness Program is an evidence-based intervention that helps older adults at any level of fitness become more active, energized, and empowered to take care of their health. The fitness class lasts for about an hour with about 20 to 30 peers and is offered in both in-person and remote settings. Enhanced Fitness has been proven to improve physical function, reduce medical utilization, decrease mortality rates, and provide a social benefit to the aging population. With these successes, this intervention would be a great tool to utilize in rural communities in Wisconsin to get isolated aging individuals involved and feeling connected. The community and organizational level of the model is important in encouraging support and connection between community leaders and community residents. The Non-Emergency Medical Transportation Program, or NEMT, aims to enhance the ability of the rural population to solve problems and achieve a goal. In this case, the NEMT program is utilized to ensure individuals can reach everyday destinations such as jobs, schools, healthy food outlets, and healthcare facilities with safety and reliability. Transportation impacts about 3.6 million people in the U.S. from getting proper medical care. NEMT has been shown to be a community outlet to address these concerns. Increasing access to public transportation can help address inequitable access to medical care and increase health outcomes for rural residents that are isolated without the access to reaching medical care. Addressing the despair in healthcare at the societal level goes in part with addressing current public policies. Public policies are created at some point in time when an issue surfaces with best intention to support the greatest amount of good. However, due to financial constraints, legal bearings, and cultural differences, the development and implementation of policy changes take time. In the 2024 Biden-Harris administration, action was taken to improve the health of rural communities to aid in keeping rural healthcare open and available. $30 million were allocated for technical expansion, $13 million were used to support the dying workforce, and $45 million were allocated to the implementation of telehealth. People are seeing the impact of telehealth and what it could really do for rural communities and taking steps to making this dream a reality. If and when public policy takes a step in the direction for change, support comes with it. In many interventions, this is the piece of the puzzle that is waited for, but once achieved, change can blossom. All in all, each intervention shared is connected to the usability of the social ecological model to guide interventions that can be taken and implemented into nearly every community. Rural leaders must come together to offer online programs that can be used on an individual basis to support health, open group classes to support physical and social well-being, expand access to public transportation to ensure people are able to reach resources, and passing evidence-based research on to policymakers that can make decisions on the advancement of rural communities and equitable healthcare. Here are the references used in my research. Thank you for listening.